Medical Advisory Committee Chairperson Mmapapatla Ramokgopa has praised those who protested at Soweto's Hani Baragwanath Academic Hospital. Workers embarked on a picket at the facility on Thursday over the possible sacking of over 800 doctors and nurses who were employed to help tackle the COVID-19 pandemic. Ramokgopa says the hospital has been grappling with staff shortages for a long time and that government has done nothing to address the issue.
Protest that took place on this past Thursday at Hani Baragwanath Hospital. It was a protest action that was organized from within the hospital by the clinical heads, of all the departments in the hospital, Hani Baragwanath Hospital. So now we are very concerned because already we're dealing with a shortage of staff that has been lingering for years, which we carried right from the days of apartheid, which unfortunately our own democratic government, has not corrected. We always ran with, chronic staff shortages. And when you look at this hospital, we ran at a deficit of about 900 or so staff members. And that is why often you find that you don't have cleaners, you don't have porters, you don't have enough nurses, you don't have enough doctors. Doctors and all other categories tend to overstretch themselves. And sometimes you find that some of the areas are not even attended. So this action, indeed, it was something that was organized and carried out by all of us that felt that, this situation needs to be corrected.
Meanwhile, the Gauteng Health Department has blamed the move on budgetary constraints. Health MEC Dr. Mmapapatla says the department is working on retaining as much staff as possible.
People are having sleepless nights. They call me even in the middle of the night to say, I can't sleep because I'm not sure what is going to happen. But what we're going to do as government, we are going to make sure that we keep as much as possible a number of healthcare workers, because we know that the organizational structures of different hospitals does not cater for the intake of patients. So these contracts, we will be renewing those that we know that they are critical, but the hospital CEOs and clinicians must be able to say, we are prioritizing these category of healthcare workers.
Well, for more on this story, let's take you to the Treatment Action Campaign's Zvungile Chabalala and Hani Baragwanath Hospital Head of Surgery and Wits Head of Surgery too, Professor Martin Smith. Good evening to both of you and thank you so much for your time tonight. Professor Smith, let me begin with you because you were one of those that was part of this picket that took place on Thursday. When you hear what the proposal being put on the table by the department about the fact that there will be a selection criteria effectively of who is retained at the hospital, does it sound like a viable solution?
So thanks, Kathy. I'm not comfortable with that solution for two reasons. The first reason is that I think that the maldistribution of the health spend in this province is chronic and has been to the disadvantage of Hani Baragwanath Hospital for many years. And it's that that hasn't been addressed. We have on many occasions motivated for why we think as an institution we have not been allocated the appropriate budget and that our staff establishment doesn't reflect what the clinical needs, what the burden of disease that gets to this hospital requires. So I think it's that maldistribution. It's that methodologies used to allocate funding in a way that we certainly as clinicians at Hani Baragwanath Hospital do not support and do not believe reflects our situation. So I think that's the major issue that we're concerned with. The second one is that I think that we don't know how this redistribution will happen because we have people in posts already. They understood that their contracts come to an end, but it only was last week that we were finally told that there would be no extension when we had motivated for a long time. And I think it's irresponsible and unfair to leave young health professionals and any cadre of worker without certainty about what's going to happen in the beginning of the next month. And I think that hasn't been appropriate. And I think that people need to explain why they left it so long before these people. Yes, they knew their contracts would come to an end, but at the same time, we knew what our requirements were for a hospital, and we kept motivating. We put in these kind of requirements that we needed. So why did we only find out about it last week? And why have we left these people with no options? Through their commitment to their patient care and to the hospital, they've remained in these positions and have indicated that they would like to stay on in these positions. So they don't have other opportunities. And so I think that, again, I think that's irresponsible.
When we listen to the MEC again on who exactly may be retained at the hospital, it seems that the department is placing the bulk of that responsibility on the hospital to say who they're keeping and who should go, but assessing what the critical skills that are needed are. One would have thought everybody is critical, but it doesn't seem to be the understanding of the department.
So, by example, in my department, if I've got 2 doctors in these posts and I've got to tell one doctor to go, on what basis do I do that? What fair method can I possibly use in 3 weeks to determine who should stay and who should go? And I personally don't think that I'm able to do that. I think everyone has committed. Everyone has, during the last 2 years while these people have been employed, have shown that they're committed and that they're good health professionals by and large. So I don't know. When you say that it's up to the hospital to make those decisions, well, the hospital's going to tell me to make that decision in my department, and I don't know how to make that decision. So I think that that's the challenge, leaving it so late and then leaving it to the hospital to say, well, you've got 400 out of your 819 posts, deal with it. I can't see how that's fair and how that's a reasonable request.
Ms. Chabalala, as a treatment action campaign, what do you make of all this?
I think everybody knows that we've been talking about this issue of shortages of human resource in our healthcare system. And as people are losing their jobs and they are not extending contracts, it tells us that the government that is leading us, especially in Gauteng, doesn't care. We have a crisis in Gauteng. When the healthcare workers were toying in Chris Hani Baragwanath, we shared to say we understand why, because healthcare workers are working under conditions that are not conducive for them, and we can't expect healthcare workers to provide services while we have long shortages of nurses, long shortages of cleaners, porters. As Dr. Smith has been saying, most of the healthcare workers that are very needed, which are crucial in the healthcare system, are not there. But now we managed to get these people, and now we are placing them. But the reasons for them, we understand that their contracts are ending because COVID and other things, but we still have a crisis in Gauteng. We still have a crisis of healthcare system in Gauteng. So why are we not taking these doctors and nurses or healthcare workers to place them on those posts that have been vacant for a very long time? We know in most hospitals in Gauteng, we have acting CEOs, we have acting who's and whose positions are not filled. Why? We need the government of Gauteng to take responsibility and fix the broken healthcare system of Gauteng.
Of course, the challenge that we're facing here, isn't solely about the impact that this is going to have on these young doctors that have just come into the system, and as Professor Smith has highlighted, have really been treated unfairly. It's also about the kind of experience that patients who have to access the hospital are going to have. And given the fact that Charlotte Maxeke Hospital still remains closed, and only a portion of it has been reopened, and there's very little capacity there. So what message do you think this is ultimately sending to patients, to the residents of this province? Sibongile?
for us, it tells us that we have uncaring government. Obviously, as patients, we are struggling. For you to get healthcare services, you need to wake up as early as 2 a.m. to go to the facility. So patients are sleeping on the floors in hospitals, are sleeping on benches because they are waiting to be treated. But then how can we expect a minimal number of doctors to be able to take care of all the people who are sick, who are depending on the healthcare system? Remember, in South Africa alone, 86% of our population is depending on the public healthcare system. So that is where we need to focus. That is where government needs to prioritize. So it means they are not caring. They don't think about us as patients. At the end of the day, we are left to die because the doctors are not enough. Healthcare workers can't take the burden that they are facing, and we expect them to produce good results while we are not giving them more of tools of trade and care. We need more doctors, we need more nurses, we need more porters and everybody so that our healthcare system can be fixed. But now what we are facing, more people who will suffer are patients, because at the end of the day, it will be us, patients, who will be spending 2 days at the hospital without seeing any doctor or anybody.
Professor Smith, you have raised your voice as, the collective staff of Chris Hani Baragwanath Hospital. What happens now?
Well, we haven't had a response to our request. We were told that there was a process that the MEC was following to find out how many posts were needed around the province. But we've not been given any indication that any of our concerns are going to be met. And so we don't feel that we've made much progress. Our hospital management has met with both the Minister and the MEC, but we as clinicians have not had that opportunity. And so we don't know. Part of the reason we wanted to have this action happen was to get the authorities to the hospital so that we could show them, not only talk to them, but show them the reality on the ground. And we haven't had that opportunity. So from our perspective, in terms of our objectives of what we were trying to achieve, nothing has really moved forward. And I think it's quite disappointing given the amount of coverage that this process has had, that this protest has had. It's been remarkable, the outpouring of support and the responses we've had from everyone. So why haven't they met with us? When are they going to meet with us? When are they going to see what's happening on the ground? And when are they going to hear our voices in the workplace, not just in the boardroom?
And Professor Smith, just to wrap it up, how does it feel, the fact that you as clinicians who really should be attending to patients find yourselves having to embark on this campaign just to try and have your concerns addressed?
So that's not new for Chris Hani Baragwanath Academic Hospital. We've been faced with this need to have our voices heard for many, many years. Because as I've indicated, what's going on now is not a reflection of something new. It's a reflection of what we believe has been a chronic underfunding of the institution. And so this is nothing new. So, it's part of what we do. We see it very much as our responsibility to the patients and to the communities we serve, that we can't be silent and that we need to raise our voices. We need to highlight these issues and give our perspective on it. We're very pleased when patient groups and other advocacy groups, reflect on the same thing. But we as the advocates of the vulnerable and the underserved populations, we need to be heard. We need to be saying this. And so this is not new. We've been doing this for many, many, many years. And so we just, we believe that our cause is correct. We believe our cause is just. And we believe we need to be heard.
Sure. Professor Martin Smith, the head of Department of Surgery at Chris Hani Baragwanath Hospital, Sibongile Chabalala, you heard there, the Treatment Action Campaign also calling for some form of solution that can really respond to the challenges that have been raised.